my name is Douglas Adams, and for some of you that maybe think you've read my book, I'm the different Doug Adams. So actually, to be honest with you have to have humor in this business or you can't do this job. So we started Qura about 9 years ago. This is actually our second public presentation to share with people what we did, but our company is focused on chronic disease. So in the US, about 130 million people affected by at least one chronic disease. So what we've done is develop wireless, implantable pressure sensors that monitor chronic disease. The second part of our business is the digital, the data, the analytics, and the idea of capturing tens of thousands to millions and eventually to what could be trillions of data points. And the important thing is this operates autonomously and remotely. So we're transitioning monitoring, certainly monitoring of pressure from a single episode in a physician's office to remote autonomous measuring at home or anywhere that patient tends to be. So I want to talk about the product promise of big data. And so we think as we gather devices along with the data, we're thinking that when we get to billions of data points and we start adding the analytics and the other parts to understand disease monitoring, disease progression, so we go from preserving a standard of care or a status for disease to maybe preventing. And in the long run, when we get to maybe trillions of data points, the idea would be to maybe even cure chronic disease. Hence the name Qura, which in Spanish is cure. So everybody's got a world-class team. I want to talk about the second part of our technology, which is really what we call QSmart. QSmart is the brand that we're developing that really is the data and the analytics piece of our technology. So a sensor implanted somewhere in the body could be the heart, the brain, the spine, the bladder, the eye. There's about 15 places in the human body where a change in pressure indicates a potential change of health of the organ. So hardware is what we had to develop to become a software company. And so the core of the company is really around the data and the analytics. So we talk about building the largest database possibly in the world. This is really for chronic disease. And again, I go back to the things that are important to physicians. I think we've heard some of those today, and we're on track to deliver that. So doing this work is actually fairly hard. We have about 55 patents in the company so far. We're probably a third of the way through the development of our IP portfolio. But the reason it takes so much intellectual property, this is hard to do. We focused on extreme miniaturization, extreme biocompatibility, autonomous operation, and we have for the first time a battery incorporated in the technology that has a lifetime of about 15 years. So when we started this company, the smallest device I could make at the time was the size of a microwave oven. Today, if I put 50 of these sensors in your hand, you'll ask me, where are they? So we think that Qura, if we get the technology right and the market right and all the other attributes, we think we're going to develop one of the smallest next big things in healthcare. Thanks for following us.